Millions of people will now have access to the first medication to slow down early onset Alzheimer's disease. That FDA giving Leqembi full approval, which means Medicare will cover it and private insurance could soon follow suit. And the cost is steep at more than $26,000 a year. And that does not include the cost of brain tests and scans, which are also required during the treatments. The drug has shown to modestly slow cognitive decline by 27% over an 18-month period in people with early onset Alzheimer's. But that's a big deal. So joining us now is Dr. Dean Sherzai, co-director of the Alzheimer's Prevention Program at Loma Linda University. Dr. Sherzai, thank you so much for your time. First, just talk about how big a potential game changer this really is.
It really is a big game changer because we haven't had any drug that altered the course of the disease. This is a devastating disease affecting more than 6.9 million Americans, 45 million people throughout the world. And up to now, after years and billions of dollars of treatments, we haven't had any drug that can alter the course. There were symptomatic drugs that helped with symptoms, but the disease continued at the same rate. This is one of the first two drugs that actually slowed down the course of decline. And that's profoundly significant. Now, is it a game changer as far as treatment and altering the disease process completely? No. But it's a doorway. It's an opening, which I think will have a significant effect down the line.
Well, doctor, we talked about how this seems to be effective in patients with early onset Alzheimer's. Can it be effective, in patients who maybe have had it for a longer period of time as well?
That has not been tested. That's always the case. We usually try these drugs in the first earliest stages because you can see the change better. You also hope that they're more amenable to change. But as the drug is used more and more, we will actually probably start looking at this drug in later diseases and also in other disease processes. So it's very early to speak to that.
There are so many families, who are thrilled at this. It is different from other Alzheimer's drugs, but because it targets the actual pathology. Kind of explain that.
Yeah, so although we don't think it's the only pathology, amyloid is a very dominant feature of Alzheimer's. It's one of those biomarkers, proteins, abnormal proteins that starts accumulating decades before the first onset of the disease. So here's another clue. The sooner we identify the disease, and if we have better ways to identify the disease 10 years earlier, we can have more of an effect. So amyloid is a protein that starts the damage cascade and is one of the elements that leads to the damage cascade. Tau is another one. And by affecting amyloid, by eliminating amyloid, we hope that this will actually slow down the disease significantly. But we know that there's more to this disease than just amyloid.
Absolutely. My last question for you, doctor. So many families are impacted by this disease. Even if they don't have it, family members have it. You see just how devastating it can be. Do you think there will ever be a cure for this?
We definitely think so. We definitely think there will be a cure. We don't think that it's going to be one drug, and it has to be much earlier. Early detection is key. Besides drugs, lifestyle is a big factor. We know that lifestyle has a significant effect on stopping and abating the disease process if instituted early enough. So the combination of a comprehensive lifestyle and some medications that can be instituted early enough, we think that we can definitely potentially eliminate this disease in the next decade or so.
We sure hope so. Hopefully this is a step in that direction. Dr. Sherzai, thank you so much for your time.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.